welcome to the Minister's Press Briefing here at the Ministry of Information. If you are in your house, you can definitely join us on GTV or on Facebook at Ministry of Information for this very important exercise. As I mentioned earlier, we have the Ghana Health Service with us, especially as we walk into the peak of December in Accra activities or in the festive season. We are very much aware of the campaign that the Ghana Health Service embarked on to step up vaccination. There are so many other updates when it comes to the management of COVID-19 that the Ghana Health Service would like to inform us about. I must also say that I would use this opportunity to congratulate the Director General of the Ghana Health Service for the prestigious global award that he received in Korea, which was a special citation given by the Prime Minister of Korea in recognition of his excellent leadership in creating change, especially in handling the COVID-19 pandemic in Ghana. So on behalf of Honorable Kojo Oppong-Nkrumah, Minister for Information, myself and our entire team, we say Aiko. So we are here for a simple exercise, which is an update on COVID-19. So I will not bore you with so much talk, but will yield to the Director General of Ghana Health Service to give us the updates. But before then, permit me to acknowledge some dignitaries who are with us this morning. We have with us the Deputy Director in charge of disease surveillance, Dr. Dennis Laye. We also have with us the Program Manager for Expanded Program on Immunization, EPI, Dr. Kwame Amponsa Achiano. We also have with us the Director in charge of Public Health, Dr. Franklin Esiedu Bequin. And as I mentioned earlier, we have the Director General of Ghana Health Service, Dr. Patrick Kuma Abuaje. So I will now invite Dr. Kuma Abuaje for his opening remarks, and then we'll come back to you for your questions.
Thank you very much. Good morning, all. Honorable Deputy Minister, colleagues, Ghana Health Service staff, the media. It's been a long time since we met the media on COVID, and so, as the Honorable Deputy Minister said, we are approaching a new season, a season where the risk of contracting and spreading is high, and so we felt it was very important that we will have this meeting to educate Ghanaians on how best we can protect ourselves in this period. So we will be talking about where we are, the background, what is happening globally as far as COVID is concerned, what is the situation in Ghana, where are we, what is our preparation, how have we built our capacity to withstand anything that we, in the unforeseen instance of we have a surge. Where are we with the vaccinations? And then we'll zone in on some of the key recommendations that we'll make that people should apply to make sure that we reduce the spread of the virus. This virus has been with us for the past 3 years. And even though the numbers are down, they are also up in some countries. Nobody knows when we are going to end this. And so we have to keep things up. We have seen a very significant decline in the past 3 months. With the probably, I wouldn't say the lowest. In this time, it's a very low active number of cases, and we've not had any deaths for a while now. There are surges in other parts of the country, which I will expand later to you, that other countries who normally travel to this country are also experiencing significant surges. So as we said, we are just here to discuss with you the risk we face with Christmas, our own gatherings, our practices. The fact that we're going to have a lot of people coming into the country is extremely important that we prepare ourselves for this. Of course, there's also the potential for a new variant, just like we had the last Christmas, when we had towards Christmas, when we have the Omicron variant. And so we also have to look at that as a risk factor, and so we need to be alert. And then we need to make sure that we sustain the gains made so far so that we don't go back to where we were many, many months ago. Now, I talked about some countries where we are just some countries that we selected those countries because we tend to get a significant number of visitors from that place, especially during Christmas. You can see that in the last 28 days, Japan has recorded about 3.2 million cases, US 1.57, France 1.49, China almost a million, Italy 0.85, and Germany. And so, like I said, these are places where we also get a significant number of visitors, and so that poses a risk for us, and so we need to prepare and protect ourselves. So where are we as far as the numbers are concerned? The decline in the last 3 months, as I said, adherence to protocols is quite low, even though we have advised that exercise the risk and then do appropriate things that have to do before, whether wearing masks, etc. But the adherence is significantly gone low. We have so far administered 21 million doses, and we wish we had more people, which means that we don't have the herd immunity that we need, and so that's also something that we need to look at. Currently, we've done about 171,000 confirmed cases. We've done 2.5 million tests. 169,000 of the 171,000 have recovered. We've lost, unfortunately, 1,461 cases. As at the 16th of this month, the active cases in Ghana is 4. Let's not be complacent with the 4. We started with 2, so you never know how it goes. We don't have any severe case and we don't have any critical case in our facility, so that's where we are. And you can see that we've already had, I would say, 4 big waves and two or 3 small waves. You always have some wave. Usually have a small wave before the big wave. There's been a small wave around August, September. The big wave has not come, but we can always avoid it. And that's why we are here, to ensure that that big wave never happens. So, of course, this temperature, we're having a dry season, it's a flu season, so respiratory disease transmission has the right environment to see, so we need to be very careful. So how prepared are we? Yeah, this is where we are, but are we better prepared before, as at now, compared to last Christmas? Currently, when it comes to surveillance, when it comes to us looking for a way to quickly identify the condition and respond, we are doing electronic disease surveillance across all the 261 districts. This was not so before the COVID pandemic. What it means is that we have all information in real time. So as soon as it is seen and entered digitally, we see it. I have a dashboard in my office that I see the Director of Public Health, the emergency operating centers are there. We also have 11 video conferencing facilities in 11 regions and 4 fully functional public health emergency operating centers. This is where we process cases, discuss them, and prepare our responses, and we're able to quickly share information with all who need to respond. We've also been making sure that we mainstream COVID management so that we move from the emergency mode into a place where we can manage. And so based on that, a lot of case management manuals have been done, trainings have been done, and so management, when I say management, comes from testing to initial treatment, isolation, and so at all levels, everybody knows what they can do when you have COVID. It was not the time that we had a few places, wherever you are, when it's COVID, you all have to mass up to one place. And so we are doing that, including rapid antigen testing, so that you can quickly test and identify whether the person is positive or not. And if it's positive, you move on to the next confirmation. So we are trying to ensure that we are able to manage cases at all levels of the country. And we are able to do that now. Oxygen availability has significantly enhanced. I'm sure you remember the challenge we had when we had the second or so third wave with huge deaths. Now oxygen is there. We have, apart from a few PSA large plants that we have installed across in about 3 centers of the country with support from USAID and UNICEF. We've also, as a state, has bought 56 modular plants which are currently working. They produce about 60 liters per minute. Currently, we are looking at about 84. 35 is currently being installed, and early January, we will expect that before the end of the third quarter, another 72 will be installed in our facilities, so that most of our facilities will have availability of oxygen should there be the need to have them. Our bed capacity for severe and critical cases have moved from 64 at the beginning of the pandemic to 1,150, which means that should there be any outbreak, we are better prepared now than we were at the time. But of course, if you don't adhere to the protocols and we are careless, these numbers, this preparation can be overwhelmed. And so we still need to ensure that we have that preparation. Early next year, before the end of the year or early next year, we are adding 15 more treatment centers as part of our capacity. That will increase the numbers. But we have a plan how to use them when we don't have an outbreak and how to quickly revert to them as treatment infectious disease treatment centers should there be an outbreak. So that's where our capacity is. We've also, when it comes to the laboratory, as you know, we started from 2 labs. Now we have about 60 labs, including private center lab. Early next week, we are also deploying about 4 more P3. P3 is a very high-level laboratory labs, one in Cape Coast, Accra, Hohoe, and then, what's the 4th one? And Sunyani, yes. And Sunyani. So that's the 4 that will serve those zones. We also have continuous community engagement at all levels to ensure that people remain informed about the disease and how to protect themselves. And we continue to disseminate our protocols that will help people to adhere to the protocols. So what are the at-risk places? The last time we were here, we talked about people making informed decisions about their risk level and see how they will protect themselves. Even though the disease is low, there's still a high risk disease transmission among persons when they are in closed spaces. What's very clear that once you are in a closed space, the risk of transmission is high if someone has one. And that means that churches, mosques, and other religious venues remain a challenge. Stadia and other event venues are also areas that we need to be very careful about. Cinema theaters are areas that we need to be more cautious. Nightclubs, airplanes, whether local or international, are all areas that we need to have some extra caution. And other places where ventilation is poor, there's an enclosed area, such also creates the avenue for spread. And so these are broadly the areas, of course. Workplace, if they fit into any of these categories, also becomes a risk place. But to get some of these, vaccination is extremely important. Apart from all these protocols, you also need to be sure that you have your own protection. Currently, this is where we are. If you look at the graph in the region and the district, you can see the yellow. When you have yellow, then it means about less than 25% of the population is vaccinated. And that means that the risk of transmission is very high there, especially when something comes. You can see we have a few districts in Volta and OT where we still see some places in Greater Accra. And the deeper the green, the better the coverage. And so if you see a pale green in Ashanti region or Eastern region, that is risky because that represents a large population who are unvaccinated. These are proportions, but only in terms of the numbers, they are a lot. And so we need to have it. We can see that the northern sector of the country is better protected in terms of the proportion of people who are vaccinated. But when you come to the south, Eastern, Central, Western, and Volta, we still have significant challenges as far as the number of people vaccinated are. We've been doing campaigns, and you can see that the color has been changing over the period. As we do the campaign, it becomes more green, and the yellows disappear. And so the last one is the 18th of December, where we are doing the current vaccination. So our approach for vaccination has been the routine and periodic campaigns, and that has been very, very helpful. And if you look at the next slide, it will show you see that when we do campaign, we have a jump. The first one was December 2021, when we declared as a vaccination month. We were able to vaccinate about 2.9 people, but as soon as it goes, it drops. If you come to the first one, we did 2.5 million vaccinations in 5 days. Then the third one declined to 1.3. The third and fourth was 1.9. We are currently in a vaccination campaign. We are finishing, officially today, but people are still going to be in the field to continue vaccinating because they have a certain number to vaccinate, and they will continue going on. As at yesterday, we have about 1.13 million vaccinated. We are expecting that by the end of today, we have a significant jump. And the usual approach is the last day that everybody queues. So we're expecting that the last day, more people are going to get vaccinated. But we assure them that if there are more people available, the team will continue, and the routine vaccination will still continue to be available. So these are just pictures of some of them. These campaigns are not static. We are moving beyond, we're moving the vaccine to the people, whether it's in the island, whether in the school, whether anywhere you can see where vaccination is actually taking place. And it's broad. There's a lot of campaigns, and that's why we also continue engaging our chiefs, our assemblymen, our DCs, our politicians. And I must say, the last time the parliament also got in to help, we saw a huge rise in the numbers, and we want to encourage them to continue being part of the campaign and also encouraging people to take the vaccine, because that will be the safest way that we can protect ourselves and be able to go on with our normal lives. So specifically, what are we going to do? I think we talked about the surge already, the numbers that are going to increase. We've seen them in the past Christmas before, among others. So for Christmas season, we want to reinforce the response to the anticipated surge. And we are providing more reagents for testing. We are reviewing our logistics to ensure that we are ready as part of our capacity building and ongoing engagements with the religious organizations ongoing. So for key recommendations for churches, mosques, and other revenues, irrespective of their size, the use of air conditioning, otherwise, these are the recommendations as follows. Face masks by all worshippers is recommended. And persons using shared microphones, in particular, are encouraged to ensure that they all mask all the time, especially when you are passing the mic from one person to another. It's important that such people wear their mask. Hand hygiene facilities should be available at such venues by the leaders, and advised to encourage members to appropriately use such facilities. Sometimes it's there, nobody's using it. Social distancing, where practicable, should be practiced. And of course, we need to remind ourselves about the cough etiquette so that you don't transmit it to someone else. Nightclubs, given the closed nature of nightclubs and the high humidity in such venues, the spread is quite common. So in as much as possible, we follow through with these measures, such as maintaining social distancing, and then should be observed in those places. Club owners are encouraged to provide hygiene facilities, preferably alcohol, hand rubs, out of these venues, and encourage patrons to use them. And patrons of these venues are advised that to ensure that they are fully vaccinated against COVID-19, and also encourage people that please get vaccinated so that you can protect yourself. Whether it's vigil, concerts, watch night, crossover, we are encouraging that these large gatherings be held in the open, where ventilation is good and that the risk of transmission is significantly reduced. And persons who are unvaccinated should take advantage of the ongoing vaccination campaign to get vaccinated before attending such programs. And the churches can also be helpful in encouraging their people to take vaccination. Booster doses are also recommended. Those who have not taken their booster, they should make it a point to go and take their booster shots. For other places, so long as there are aggregation of persons, the risk of COVID-19 transmission exists. So Ghana Health Service makes the following general recommendations to all individuals who find themselves in a public place or space. Face masks used all time in enclosed spaces, so I'm just rehashing what we said again. Hand sanitizer use, social distancing as far as practicable, and patrons of such venues or such events must ensure that all of them are fully vaccinated. So let me give you a few updates also at the airport arrivals. There have been a few changes there that I also want to mention. All passengers, Ghanaians and non-Ghanaians residents, 18 years and above, arriving in Ghana will be required to provide evidence of full vaccination for COVID-19 vaccine at the point of embarkment and upon arrival at the Kotoka International Airport. I am sure when you are traveling into the country, you see the health declaration form where the airlines will check your vaccination card before you enplane, whether you are Ghanaian or non-Ghanaian. Fully vaccinated arrivals who in Ghana will not be required to do a PCR test before embarking, and also are exempted from the COVID-19 testing upon arrival at the KIA. Previously, what we had was that if you are not a Ghanaian and you are not fully vaccinated, you cannot come. But now you can come. But if you come in and you are not vaccinated, whether unvaccinated or partially vaccinated, you have to do a PCR test 48 hours before you travel to Ghana, and upon arrival, we'll test you before you can leave the airport. So those are the key changes that have taken place. Previously, non-Ghanaians who are not vaccinated were not allowed in. Now they can come in, but you'll be tested on arrival and before you enplane if you are not vaccinated. There are exemptions. Children less than 18 years are exempted from pre-departure vaccination and pre-departure PCR testing and testing on arrival. So what is happening is that previously we were doing at 15, we moved it to 18. So those under 18 are fully exempted from irrespective of their vaccination status. Airline crew are also exempted from pre-departure and arrival COVID testing at the airport, but they abide by the airline policy and the IATA policy on testing by all airline crew. Travelers who are on transit, who arrive under, or those who arrive under emergency circumstances, such as diverted flights, will not be required to undergo any testing if they do not leave the airport or remain isolated in their hotel. What happens is that if for some reason you need to leave and you are fully vaccinated, then that applies to you. But if you are not, then you'll be tested before you can. So finally, what is the outlook of COVID-19? We have increased access to vaccines for COVID-19. We still have pockets of vaccine hesitancy that pose a risk to the gains so far made. And what is happening is that people feel that they are low risk, and that's our greatest challenge. The low risk perception is a key challenge for us. People feel that it's my friend who will get COVID, but not me, so I will not get vaccinated. But I must tell you that if there's a surge, it's the unvaccinated who will be at most risk. So you ought to, strict enforcement of the protocols on international travels is key to reducing the importation of diseases. Currently, apart from the expansion at the ports, we have also done expansion at the land at the land borders, where we have about 7 out of the 13 set points have been upgraded with prefab offices. We have 3 ambulances at Lubo, Lome, and then the Paga border for any emergency. And we are going to add some laboratory tests to the place to ensure that these places are all. But other test areas are fully occupied to make sure that we are able to prevent importation. There may be a surge of cases, especially from international travelers, with the testing of cases and with the impending Christmas, and so that's why we are here. That's a risk, but we can always avert them. The risk communication, that's the education that we are doing, is important. Vaccination and adherence to COVID-19 protocols are still essential. So, Honorable Deputy Minister, ladies and gentlemen here, this is the brief of the president. So, we are here to ensure that we get more prepared and also assure you that the system is prepared to respond to challenges, but we can always avoid such challenges. Thank you very much.
Thank you so much, Dr. Kumar Boaji. Some of the key points that I took from this presentation is the recognition that there are surges in some countries from where we receive frequent visitors. So it also has a potential to cause a surge in Ghana if we do not adhere to the travel protocols and also the general COVID protocols. The DG also mentioned that the Ghana Health Services is committed to improving capacity and expanding infrastructure so that they can efficiently deal with COVID and other public health emergencies. Particularly, he mentioned that early next year, the Ghana Health Service is adding 15 more treatment centers in Ghana, and that when it comes to labs, testing labs, they have increased from 2 to 16 already, and have the intention to add 4 more P3 labs in Hohoe, Cape Coast, Accra, and Sunyane. So please let us adhere to the protocols and cooperate with the Ghana Health Service so that they can protect all of us. With that being said, I would like to invite your questions. If you have any question, kindly mention your name, your media house or affiliation, and then proceed to ask your question. Yeah, John. Okay.
Thank you. My name is John Awuni. I represent Kesben. Director General, congratulations for the award you picked in Korea. Even some 3 months back, I remember WHO praised Ghana for the manner you handle the COVID issues and other public sector, other public health vaccination program that has been rolled out by the Ghana Health Service. But I just wanted to get some few details about the award. What exactly was it about from Korea, and how going forward it will urge you to continue to contribute to the health needs of our country? Thank you.
Thank you, John. Take this question.
My name is Salom from the Finder newspaper. Dr. Kumar Boaji, there are concerns. I've spoken to people who have concerns about the efficacy of the vaccines. So, for instance, they would point to the polio vaccine, which is essentially going to inoculate you completely from contracting the polio virus. But in the case of COVID-19, you take the vaccine, but then you are not completely protected. There are instances, for instance, of people in the Democratic Caucus, for instance, in America, who have had like 3 shots, but have still gone on to contract the COVID-19. We hear these reports. Of course, you hear it in Ghana, but also you hear these reports that people have taken 3 shots, 4 shots, but they've still gone on to contract the vaccine. So in the case of these people, what assurance do you have that the vaccine works? Because the concern is that we take the vaccine, but we still hear of people getting the COVID virus.
Thank you, Salom. Please, okay, Nana, we can take some more questions.
Yeah, good morning, Doc, and congratulations. I have 3 short questions. If you have taken the complete jab the other time, do you still need to take another jab or a booster for that matter? And 2, when you went out there for your outreach program, what was the response like? And what were the challenges that the people or you faced in doing that? And the last time you did indicate that pregnant women and children under 18, you have just mentioned this morning, were not part of the vaccination program. Are you going to include them? And yeah, that's what I want to know from you. Thank you very much.
Thank you for the question. We can take 2.
Good morning. I'd like to find out, please, if we could get any update on the monkeypox situation in the country. And then the season we're in, the flu season, if we could, if the services are aware and could update us on what to look out for and, situations governing the flu-like temperatures that we're in and how that relates to COVID-19, any general conversations on the back of that.
Thank you for the questions. We can take one more question if there is any hand up. Okay, Paul.
Good morning, Honorable.
Good morning.
My name is Paul Nyoye Dalafu. DG, thank you very much for your presentation and congratulations for your awards. And I think my own is a plea from a friend in the northern region. According to him, they have a health facility, which is a CHIPS compound. It was built sometime 10 years ago and has been deteriorated. So through their efforts, they were able to raise some money to refurbish it. And now they are able to finish it. They have the nurses, the medical apparatus are not there. So they have issues like no drugs and no bed for detention of patients with mild sickness before referral. And I've been asked to put it before you to see how you will do it. And the place is Sanguli in Saboba.
Thank you for the questions. So I will invite Dr. Kumar-Boaji back for his responses.
Thank you very much. There are 2 questions I'll just tap on briefly, but the Director of Public Health will give further information on. Thank you very much. I think the award for me is more for all of us, health workers and all those who assisted. Basically, Korean government assists us in many things, primary health care, etc. And so they are looking at, okay, what was the intended outcome? Did we achieve results? And I think we have programs where we have seen very good results. They've supported us in our COVID implementation, all that. And we've seen that we've been prudent, we've gotten results. And so I will see myself as leading and collecting on behalf of health workers in Ghana Health Service and other places, and all of you who, through one way or the other, whether exerting pressure on us to do better, has also helped us to improve. So that's how the whole is about. It's not just on COVID, but also the other programs that they are supporting the country, where they have seen significant improvement in outcomes, reduction in mortality, prudent use of their resources. These are the areas that they are looking for. That's why we got the award. So you want to know the efficacy of the vaccines. I will touch on, but the Director Public Health is a program manager will be here. I think we've already mentioned that there are vaccines that protect probably about 45%. Okay? But you look at the cost-benefit analysis. If you take a malaria vaccine and 1 million children get vaccine, malaria a day, for example, and you can avert 450,000, is it worth it? What the COVID vaccine does, as we have people explaining, is that we are saying doesn't always protect you from getting another infection. But what we can be certain is protecting you from getting sick and dying from it. And so it is a major effect that is assisting in helping. But even for those, the possibility of getting another one is reduced compared to the unvaccinated. So that is the tragedy. But I'm sure as technology moves on, as we continue engaging the disease, better vaccines will come that will give us, but it still give us the best option that we have beyond any other thing, protecting you from dying and preventing you from getting admitted or getting seriously sick and leaving you with other conditions that you wouldn't want. The last time, the booster, the challenges on the field, maybe that Dr. Chanu will add, but clearly we still have some hesitancy. We still have people who feel that they are not at risk, and so they are not taking advantage of it. Of course, access to some parts of the country can be very difficult. Either you have to walk through some river, wait for a boat before you can reach. So these are all physical challenges that they have been faced on them. But the health workers are very motivated to continue. And that is why in the last 4 days so far, I will give it 3 days, because even at the end of the 4th day, you're only going to get probably up to about midday data that they've been able to do almost 1.2 million doses. And so I think in both directions, both the demand is also improving. Booster, yes, it's extremely important. Once after 6 months or so after the last vaccination, the antibody protection wanes. And so that's why there's a need to do a booster to keep you up. And so people are going to, currently our national policy to give 1 booster. We will continue to review. If there's a need to do a second booster, we will, as we study people's responses to these viruses. The last time, I don't remember ever saying that pregnant women are exempted from the vaccination. Children 15 years and above qualify, but pregnant women also qualify. Dr. Essedu will talk about the monkeypox. And we take note of the Sabuba issue, engage the district director and the regional director and see how we can address that. Thank you.
Thank you very much, DG. So let me just say that before a vaccine is accepted by WHO of use, the efficacy must be more than 50%. And for now, the vaccines that we are using in Ghana, all of them have the efficacy more than 60, even some going to as high as 90. And as was said by DG, so the vaccines does 3 main things. It reduces the risk of infection, it also reduces the severity of the disease, and possibly averts death. So that's how come we opt to get vaccines. For monkeypox, let me say that we are actually testing in 3 labs in the country, so Noguchi, KCCR, and our reference lab. As at yesterday, we recorded 116 cases. It used to be a bit more frequent earlier on, but for now, we are getting maybe just 1 or 2 cases per month. So it's not so much of a big public health issue. 60% of the cases are actually males, and they are dominantly in Greater Accra. I think there was a question about the flu season that we are in. Ghana is running a flu sentinel surveillance in the country. So we have sentinel sites in all the 16 regions, and the common pathogen has been the H3N2. There are a few instances that we have H1N1. So what you do is that if you present to one of these sites with a fever and a cough, they pick the sample and they test it for COVID and also test it for whether I have a flu A. And so far, it has been good. What we want to say is that let's maintain cough etiquette in this era that we are in. Thank you very much.
Ladies and gentlemen, if you have any follow-up questions, we can take that. Yes, Nana.
Must go other the clinics or certain designated points. Thank you.
Please, any other questions? If not, I will invite Doc back to respond and also to give us his concluding remarks. Okay.
Thank you very much, DG. Yes, for vaccination points, as pertains now, currently as we're doing the vaccination, the campaigns, or we have three major strategies. We are doing the static. So all public facilities, you get vaccines. You also look out for what we call the outreach services. So usually the places that we normally do the childhood vaccinations, you find the healthcare workers there. There will also be people who are moving from place to place. Beyond the campaigns or public health facilities, you should get vaccines there. Thank you.
Thank you, Honorable Deputy Minister. I think as we conclude, the message is clear. We are moving into a season where the risk of a surge in the numbers is rife. We also have the capability and preparedness to support any such surges. But like I said, we hope that we don't need to get to that level. So we are here to provide evidence and support and advice that, one, let's make sure that we abide by the protocols. Let's ensure that we are also doing as many things as possible in the open as possible. Where gatherings can be avoided, let's avoid them. Where we can maintain social distancing, let's maintain it. And anybody who has any symptoms, whether it's cough, sneezing, etc., please report to the nearest facility, because it's when we identify that you have a case that we can isolate you and prevent you, and you also prevent yourself from infecting your loved ones. So we want to thank the media and the Minister of Information, Deputy Minister, for this opportunity. Thank you.
DG and your team, thank you so much for being very consistent on when it comes to these updates. And ladies and gentlemen, thank you for making time to join us on a Sunday. Enjoy the rest of your weekend.